Hello, my name is Dr. Carlo Renato. I'm a chiropractor from Sydney, Australia, and heading towards Rome in September 22-23 to present my Managing the Dizziness Patient seminar. And this is a great seminar for all practitioners, for all chiropractors who want to better understand and learn how to manage patients that present with dizziness. And believe me, there are many patients in your office that perhaps aren't responding as well as they should be with just spinal care only. And whilst I'm not taking away from what we currently do as chiropractors, I really want to enhance an understanding and therapies that we can provide to our patients. So in this seminar, we're going to be covering over 1.5 days many aspects of vestibular function, vestibular assessment, and vestibular management as well. So today I want to be talking about a little bit of the neurophysiology, something that we need to cover in our seminar, because without an understanding of the connections between our spine and our eyes, our spine with our balance centers, our spine and with our inner ears, we're often going to not see the connection or not understand how is it that these are put together. And why is it that someone's presenting with blurred vision when they're coming in with neck problems? Or why is it that someone's presenting with visual instability when they've had a recent inner ear infection? So we want to understand these components, and we're going to talk a little bit about that. So most of us are aware that balance is comprised of what we see, what our inner ears experience or detect, as well as what our muscles and joints detect as well. So visual, vestibular, and proprioception go together in various parts of the brain and gives us a map of where we are in space. So we know where we are, we know where we're going, we know what direction we're moving or what direction we want to move to. So this aspect is really important. And this information gets put together and integrated. And then there's a motor response or an output that occurs that either controls our eye movements or controls our spine and body position. And as chiropractors, that's a very important thing for us to be able to understand. So we're going to go through some of the physiology behind this. Again, not in great detail, but enough that we can put a concept behind what is it that we see in practice. And we're going to open up and we're going to explore that vestibular system. And it's such a beautiful motion detecting system that occurs in our inner ear, that when we turn our head, we have these activations of these little hair cells, which you can beautifully see on the screen here. And that contributes to our eyes moving, as well as our body and particularly our cervical spine, producing an appropriate movement or posture to make sure that we're stable in our environment. So, we'll go through some of the pathways, and again, more conceptual rather than in a lot of detail, but something that you need to be aware that the vestibular system, the eyes and the spine are heavily connected. And as I said, they connect with our eyes and they certainly connect with our spine as well. Following from that, we're then going to talk about various conditions that you're most likely to see in your office. And they involve more than just simply the neck. And these conditions can involve the inner ear, for instance, BPPV, a neuritis, a Meniere's, or it can be more of a central disorder, something that affects the brainstem, like a migraine or a stroke. And how is it that we as practitioners, as primary care practitioners, how is it that we can discern the difference between a vascular incident and an acute vestibular peripheral incident? And believe me, what we do with these patients should vary considerably. One's an emergency, one's something that we can manage. But are you able to discern both through a history and an examination the difference between the two? And if you don't, I strongly suggest that you do, and we're going to cover that as well. Once we have a list of conditions that we more commonly see, we're going to talk about the history. And how is it that in a series of 5 or 6 questions, we can almost determine what the condition is. Is it a peripheral? Is it a vascular incident? Is it a peripheral incident that can be managed in your office, or is it something that's different? Okay, so we're going to go through that. And typically we'll use an algorithm, and this is just part of one algorithm that we'll use, that through a series of questions that you ask, you can almost elicit or come down to a differential diagnosis as to what the problem is. So I've just quickly covered what we cover in about 3 hours of some of the basic neurophysiology, some of the conditions, and some of the history aspect that we'll cover in our managing the dizziness patient. So be sure to visit www.brainhubacademia.com for further information or how to register. Take advantage of Early Bird, which closes August 24. This is likely to sell out before that time, so be sure to secure your spot. I look forward to seeing many of my friends and colleagues in Rome at this seminar, 1.5 days. I look forward to seeing you then. Until then, bye for now.